Shared decision making is something that's been quite well described and quite prevalent really within healthcare settings recently. But it's surprisingly difficult for clinicians to really integrate shared decision making into their practice. And we were interested in how that might apply to a condition like tinnitus, because tinnitus is a chronic condition and it's a condition with a very heterogeneous population where there are a wide range of different responses. So we wanted to make sure that the offering that clinicians make to their patients is well matched by the preferences that patients have for treatment.
One of the audiologists here. Do you mind if I check?
There were 3 stages to the research. First stage involved some qualitative interviews with patients with tinnitus to find out what their preferences are for treatment and what their preferences are for outcomes of treatment. The second stage involved videos of interactions between clinicians and patients with tinnitus to observe and describe how those decisions are made in clinical practice. And then thirdly, taking the findings from the 2 earlier stages to develop the decision aid. Easy, straightforward.
We had a really great research team. We had 3 researchers who were involved in day-to-day gathering of data, and then we had a wider research group which included people from health and clinical psychology backgrounds and clinical scientists and experts in tinnitus. And we also had patients who have tinnitus as part of our steering group as well. Typically, there are 3 phases in clinical encounters where there's an opportunity to incorporate shared decision making. The first phase is the building of the relationship between the clinician and the patient so that the patient's preferences are heard and form part of the information that the clinician gathers. The second phase is around weighing up the different options that exist for the treatment, in this case for tinnitus, and comparing the kind of pros and cons of the different treatments. The third phase is weighing up the final decision. So that's about integrating the preferences that people hold with the pros and cons that have been discussed about each individual treatment option. These video examples are based on some of the observations that we've made, which reveal some typical practices within audiology. And what we have tried to do is to ask real clinicians and real patients to mock up some of the typical encounters that go on, but also to illustrate some of the alternatives so that they can demonstrate how it is that shared decision making could be incorporated into clinical encounters.